Hello everyone, I am Dr. Radhika Sridharan from the Department of Oral Pathology and I am here to talk about a very important topic which is development of face. So in this video we are going to take a journey into embryology to understand how the face develops step by step. This topic is extremely important because many developmental anomalies like cleft lip, palate, we need to understand in which stage it occurs. So this topic is extremely important. So in today's session, these are the contents that are going to be covered in this session, starting from phases of development, and then we will move on to trilaminar, what is trilaminar embryonic disc, and what are neural crescents and what role do they play, and what is an embryonic fold and what is stomodium. And after that we will see how the development of maxilla and mandible happens along with the development of nose. So moving on to the important phase. So in embryology, there are three important phases that set the foundation. So the first is the growth phase. So this means increase in size and it mainly happens through cell division. The second is the morphogenesis. So this process gives shape to the embryo. And the third is the differentiation. Here the cell starts becoming specialized to perform their specific function. For example, the muscles will perform, the cells become muscles, and some nerve and some bone. So in simple words, the growth gives size and morphogenesis gives shape to the embryo and differentiation gives function. So now let's see what is an embryonic disc. So by the end of third week of development, the embryo organizes itself into three distinct layers, which is the ectoderm, mesoderm and endoderm. So this is called as the trilaminar embryonic disc because it has three layers totally. So each of these layers is important because the ectoderm mainly forms the nervous system and the surface structures, and the mesoderm forms muscles, bones and the connective tissue, while the endoderm forms the inner lining of the organs. So together these three layers give rise to every tissue in our body. So as you can see in the left side image, so we can see the embryonic disc in the form of a flat structure. So the neural plate on the top and the primitive streak at the back and the notochord lying in between. So here the embryonic disc is flat and you can see below the developing heart. So in case if the embryo continues to grow in the same position, then we all will look funny because with the heart on the top. So in order to move the structures to the future position, some kind of folding happens in the head region and in the tail region. So as you can see in the right side image, you can see the head folding happens. So the head fold pushes the buccopharyngeal membrane and the heart tube downwards. So in short, before folding, the embryo will just look like a flat disc. Once the folding happens, the structures will move to their final positions and this folding process is what gives the shape to the embryo. So now comes a very important topic, which is the neural crescents. So now let's see what are these neural crescents and what role do they play in the development of face. So these neural crescents, they arise from the ectoderm at the border of the neural tube during neurulation, and they have multipotent potential because they give rise to so many structures. Sometimes they are called as the fourth germ layer because they give contribution to so many structures, especially in the head and neck region. So they basically originate from the neural tube and they migrate throughout the embryo. So from cartilage and bones of the face to connective tissue and even some nerve components. So these neural crescents play a central role in the facial development. So now let's see how these neural crescents are formed. So in the early embryo, the ectoderm thickens in the midline and form the neural plate, as you can see in the first image. So this edges of the plate elevate and fold towards each other and they form a structure called this neural fold. At the point where these folds meet and fuse together, they form neural tube. Now the cells located at the tip of the neural folds at the junction between the neural plate and the surface ectoderm, they undergo some special changes. So these cells separate from the neural tube and they migrate, and these cells are called as the neural crescents, and this is how the neural crescents are formed, and they migrate to different parts of the embryo and they give rise to different structures. So in summary, the neural crescents are formed from the borders of the neural plate during closure of the neural tube, and they migrate to different regions where they play a major role in the development of phase. So as the neural tube forms, the front portion expands into three main divisions, which is the forebrain, midbrain and the hindbrain. In the hindbrain region, you can see in this image, we have 8 bulges which are called as the rhombomeres. So the midbrain and the rhombomeres 1 and 2 helps organize the migration of the neural crescents and contribute to the development of phase and the first branchial arch. So what do these neural crescents do when they migrate? So this diagram will give an idea how the neural crescents migrate to different parts of the embryo. So the purple color indicates the neural crescents. So based on the region where they migrate, they are named as cephalic neural crescents if they migrate to the head region, and they are called as cardiac neural crescents or trunk neural crescents, or they are called as the enteric neural crescents. So in this diagram, you can see some green zones which shows positive signals that attract the neural crescents, while the red zone shows negative signals that restrict where they can migrate. So by the end of third week, around 21 days of embryo, the head of the embryo bends forward, creating a fold which is called as the head fold. So this head fold is something important for positioning the structures. At this stage, 2 important bulges are visible. So as you can see in this image, the developing forebrain in the first above and the pericardium or the primitive heart in the below. So between these 2 bulges, you can see a depression called the stomodium, so which is the primitive mouth. So this is the first visible landmark of future oral development. So now let's see how the development of pharyngeal arches, grooves, pouches play a role in the development of phase. So on the sides of the embryonic head, you can see a series of bars which are called as the pharyngeal arches. Each arch contains a cartilage, muscles, blood vessels and a cranial nerve. So between the arches are the grooves on the outside and the pouches you can see on the inside. So these arches are very important because they form the specific parts of the face, jaws, tongue and neck structures. So for example, if you see, the first arch contributes to maxilla and the mandible. So the phase starts taking its shape between the 4th to 8th week of development. The first structure to appear is your lower jaw, which is the mandible, which starts around 4th week. At this time, 5 main prominence you'll be able to see. That is 1 frontonasal process, 2 maxillary process and 2 mandibular process. Apart from this, lateral nasal process also plays a role in the development of face. So together, these prominences, they enlarge and they merge together and gives a face, human face. So together, these prominences grow, enlarge and eventually merge to form the recognizable human face. So as we have already seen, stomodium is the primitive oral cavity, which is a shallow depression between the developing forebrain and the developing heart. So initially it is separated from the developing gut by a thin membrane which is called as the buccopharyngeal membrane. So this plate consists of ectoderm on one side and endoderm on the other side. So eventually this buccopharyngeal membrane breaks and it allows a connection between the mouth and the foregut. So which is the beginning of the development of the digestive tract. So now let's see how the formation of maxillary and mandibular process happens. The first pharyngeal arch is one of the most important structure in the facial development. It divides into 2 prominences, which is the maxillary process and the mandibular process. 2 mandibular process grow towards each other and eventually fuse at the midline to form the lower jaw, which is the mandible. So the 2 maxillary process grow medially and upwards and they form upper jaw, lateral part of the face and the cheeks. They also play a role in shaping of the upper lip and by merging with the medial nasal prominences. So the first arch alone is responsible for the most basic framework of the face, the upper and the lower jaw. So now let's see the development of mandible in a much more detailed way. So in the region of lower jaw, the first structure to appear is the mandibular division of the trigeminal nerve. So interestingly, this nerve develops before the bone, and its presence is thought to influence mandibular osteogenesis according to some studies. So within the first pharyngeal arch, Meckel's cartilage forms, and it serves as a potential scaffold but not directly ossifying into the mandible. So by the 6th week, intramembranous ossification begins near the inferior alveolar nerve, and the bone spreads to form body and the ramus of the mandible, creating a trough for developing tooth buds. Thus, mandible forms in close association with both the nerve and the cartilage. This is a striking example of coordinated growth. So now let's talk about the Meckel's cartilage, which is a key structure in the first pharyngeal arch. So in each half of the mandible, a single ossification center appears around the 6th week of intrauterine life. Bone formation begins near the inferior alveolar nerve and its incisive branch, and then spreads upwards to form a trough for the developing tooth buds. This ossification extends dorsally and ventrally through intramembranous ossification and give rise to the body and the ramus of the mandible. So this Meckel's cartilage acts as a guiding template while the true mandible develops adjacent to it by ossification. So in the neonatal mandible, the ramus is short and wide, and the coronoid process projects above the condyle, and the body is a shallow trough containing the tooth buds. At birth, the two halves are separated at the symphysis menti, which fuses between 4 to 12 months. Postnatal growth occurs at the condylar cartilage and the posterior border of the ramus and the alveolar ridge, gradually transforming the small neonatal mandible into the functional jaw of a childhood. So now we have seen about the mandible. So now let's look more closely at the maxilla. So during the early weeks, the maxillary prominences increases in size and grow inwards, pushing the medial nasal prominences close to the midline. This inward growth is extremely important because it helps eliminate the formation of clefts between the maxillary and the medial nasal prominences. So as these prominences fuse together, they establish continuity in the upper lip and the jaw. So if this process by any way, if it is incomplete, we get anomalies like cleft lip or cleft jaw, where there is a gap in between the cleft upper lip or the alveolus. So proper fusion of the maxillary prominences is extremely important for a normal looking face. So now let's move on to the development of nose. So by the end of 4th week of development, two small oval thickenings appear on the lower part of the frontonasal prominences. So these thickenings are made from the ectoderm and they are called as nasal plecodes. So they actually act as a primordia for the development of nose. So in this slide you can see frontonasal process which gives rise to the upper part of the face and the nose. So you can see on the surface there are two small oval thickenings which are called as the nasal plecodes. So what happens is these nasal plecodes sink inwards and they form a depression called as the nasal pit. So around each nasal pit you'll have ridges of tissue grows. So these prominences are called as medial and lateral nasal prominences. So these prominences fuse with the maxillary process and contribute to important structures called the nose and the upper lip. So basically these plecodes are the primordia for the development of nose. So now the nasal pits, now the mesenchymal cells just beneath and around the nasal plecodes starts to multiply. This growth pushes up the tissues around the plecodes and these form a horseshoe shaped swellings. So the inner swelling is called as the medial nasal prominence and the outer one is called as the lateral nasal prominence. So as the plecodes sink deeper into the tissue, they form some small depression called as the nasal pits. So these pits are the early beginning of the nostrils formation. So you can also see a groove which is called as the nasolacrimal groove, which is present between the lateral nasal prominence and the maxillary process. So this groove will later form into nasolacrimal duct, so which connects the eye to the nasal cavity. So now let's take a closer look at the nasolacrimal groove. So between, as you can see in this image, between the lateral nasal prominence and the maxillary prominence, there is a furrow or a groove which is called as the nasolacrimal groove. So from this groove, a solid cord of cells develops, which later hollows out to form a duct which is called as the nasolacrimal duct. So this duct basically connects the corner of the eye to the nasal cavity. So this is why tears drain into the nose when we usually cry. So and why our nose runs when we are emotional. So in case if the duct fails to open properly or if it doesn't canalize properly, then we can see blocked tear ducts which sometimes require surgical intervention. So in this slide you can see where the nasolacrimal duct lies in the medial corner of the eye. So this duct is a small passage that connects the medial corner of the eye to the nasal cavity. So in case if the nasolacrimal duct doesn't open properly, so babies will have some watery eyes. So this is the obstructed nasolacrimal duct. So next coming to the nasal sac. So once we have seen that once the medial and lateral nasal prominences are formed, the nasal placodes sink down into the depression and they are called as the nasal pits. So by the end of 6th week, these nasal pits deepen further and they form a nasal sac. So these sacs represent the very early form of future nasal cavities. So in the early stage, the nasal sac and the oral cavity are divided by a thin wall that is called as the oronasal membrane. So by the end of 6th week, this membrane actually breaks down. So the rupture establishes a connection between the nasal cavity and the oral cavity, allowing a free passage. So this communication is extremely important in the forming of respiratory pathway. Once the oronasal membrane disappears, the connection formed is called as the primitive corna. Initially, this lies behind the primary palate. As the development progresses and the secondary palate forms, they shift their position backwards and takes its final position at the junction of the nasal cavity and the pharynx. So the final position is called as the definitive corna, and that is what we can see in the adults. So in case if it fails to canalize, then it leads to cornal atresia, which can cause breathing difficulty in the newborns. So this is the importance. So meanwhile, what happens inside the nasal cavity? So inside the nasal cavity, on its lateral walls, there are three important structures: superior, middle and the inferior concave. So these are bony projections that help in conditioning the air that we breathe by increasing the surface area for humidifying and filtering. Also, the roof of the nasal cavity develops a specialized ectodermal epithelium. So this becomes the olfactory epithelium, which is essential for sensing the smell. The olfactory cells from the nasal epithelium send their nerve fibers upwards into the olfactory bulb, which is a part of the forebrain. So this creates pathway for the sense of smell. So this is how we could sense our smell. So interestingly, this system becomes functional quite early, and the fetus can actually detect chemical stimuli in the amniotic fluid before birth itself. So now let's look into nasal septum. So the nasal septum develops as a downgrowth from the fused medial nasal prominences. By around the 9 to 12 weeks, it extends downwards and fuses with the developing palatine process just above the hard palate. So this process divides the nasal cavity into right and the left halves. If this fusion is defective, then it can result in midline anomalies, such as clefts or deviated septum later in life. So this is a picture will give you an overall idea how an embryo looks at 6th week. The structures becomes more distinct. You can clearly see the frontonasal prominence above, the nasal pits in the center. On either side you can see the medial lateral nasal prominences, and below them the maxillary prominences and the mandibular prominences are also evident, so which will form the jaw and the parts of the face. So at this stage the face is beginning to take a shape and the future nose is well outlined by these prominence. So in the next session we will see about the development of palate, tongue and the development of eye and ear. So that's all for today's session. So in the next session we will continue with the development of palate, tongue and the development of eye and ear. Thank you.